Hello everyone and welcome to the Radiology Gym. Don't forget, your brain is a muscle. If you don't use it, you'll lose it. So let's go to the gym and start practicing. I'm Dr. Ahmed Abdul Wahab and I'll be your coach for today. Stay with me.
Hello, sir.
Hi dear. How are you?
Sir, I'm fine, but I want to do a practice session with you, but I want to tell you I'm not feeling very good today, so if you have anything simple, just to make me get more oriented and to make me ready for a more difficult case in the future.
Yeah, sure. We have a lot of different kinds of cases. For example, we have this 28-year-old female patient who had a trauma to the knee, and X-ray was not very helpful, so MRI was requested for her. So would you like to start?
Yes, sure, sir. First, let's see some T2 sagittal images. So these are sagittal T2 weighted images of the knee of this patient, and by scrolling, I can see there's nothing really significant here. Probably we can go to the T2 weighted fat saturated images for more information.
Okay.
These are T2 weighted fat saturated sagittal proton density images, and here I can clearly see an area of bone marrow edema here at the anterior aspect of the lateral femoral condyle.
How do you know this is the lateral femoral condyle?
Well, obviously the fibula is here, and fibula is on the lateral side, so this is the lateral femoral condyle.
Excellent. So, what else?
Well, here I think the ACL appears slightly edematous, suggesting a partial tear of the ACL.
Okay, so do you think this is the main pathology? I mean, just bone marrow edema? What does this bone marrow edema indicate?
Usually it indicates bone contusion, some sort of trauma to the bone, causing the area of bone marrow edema.
So what kind of trauma will cause this appearance?
Sir, usually I think it's related to the patella.
Excellent, good job. So what do you want to do next?
I want to see the coronal images, please. These are the coronal, proton density, fat saturated images. And here we can see that the edematous area is involving the anterolateral aspect of the lateral femoral condyle, and we can see this ACL that appears slightly edematous. And I can't see really any other abnormality.
Are you sure? Did you forget to see anything else?
Well, we didn't see any axial images.
Good. You have to see all kinds of images. So these are the axial images, and what do you see here?
Oh, now I get it. Sir, this is you can see that the anterolateral aspect of the lateral femoral condyle is in edematous together with some bone marrow edema seen on the medial aspect of the patella, and if we looked carefully, I think there's some edema of the medial patellar retinaculum.
Excellent, good job. What else?
I can see that the medial femoral condyle is a little bit hypoplastic, and the patella is sublax laterally. We can see that the patella is going in the lateral direction.
Excellent. So overall, what does that mean?
I think this is a case of patellar dislocation laterally, and since it was dislocated, this surface is in contact with this surface, like it was like that, and they became in contact with each other, and then the bone contusion happened, and of course there is some tear of the medial patellar retinaculum due to the dislocation.
Excellent. But there is one more thing that's very important, and you have to see it in every case of patellar dislocation. Do you know what is that?
Well, sir, I can't think of anything. If you can't help me, please.
Patellar dislocation, especially if it is recurrent patellar dislocation, usually is associated with patella alta. And where do you see patella alta?
Of course, on sagittal images.
Good job. So let's go and see sagittal images.
These are the T1 weighted non-fat saturated sagittal images of the knee, and I think here clearly we can see that there is patella alta.
And how do you know that?
Well, this is easy. We need to measure the height of the patella and compare it with the length of the patellar ligament. If the ligament is longer than the patellar, then this is patella alta, and of course here the patella is shorter than the patella ligament, indicating a case of patella alta.
Excellent. Good job. So you see, you need to look for the patella in all cases of patellar dislocation and exclude the presence of patella alta. Good job. See you later.
Thank you, sir. Bye-bye.
So this was our exercise for today. Don't forget to like, subscribe, share, and tell your friends about us. Keep supporting us. If you're looking for any private training sessions, send a message to the email in the description box and we will arrange something. See you later. Bye.